Okay, so we're back. So I'm recording, and the reason that I wanted to record also is to gather your information. If you are in this meeting today and you would like to receive emails about future meetings, and you did not receive the email about this meeting, but somebody else told you about it, basically anybody who's in the meeting today, if you could just in the chat, just put your name and your email address, just so that we have a record of your attendance here today. And I learned this time, if you've done this before, I may not have captured your email, because I learned this time that you have to actually be recording for it to keep track of your chat. So I asked for people to do this last month, and then I realized I wasn't recording when I asked, and so I lost data. But thank you so much for your patience today. And where are we, Angie, with newcomers? How many other newcomers do we have? Do you know?
So we just met Christina, and it looks
Okay.
like in the chat we met Ken and Ayana, and that's where we're at.
Okay, awesome.
And I see Denise just chimed in, Denise Reed from DHS.
Yeah.
Welcome.
Welcome, welcome. So if you're a newcomer and you'd like to introduce yourself, if you've never been here before, please either raise your hand virtually or just wave at me in the... Hi, Rachel. How are you?
Hi. I'm good, thanks. I'm Rachel Baker, and this is my first meeting. Leah and I were introduced through a mutual friend at United Way, so just excited to be here and hear what's going on, what the plans are.
Yes, excellent. Well, we're definitely excited to have you here. Thank you. Is there anybody else on here that would like to introduce?
Aaliyah, this is my first time.
Hi, Kamal. How are you?
I'm doing well. Yourself?
Welcome. I'm so glad you made it. I knew you were working, so I wasn't sure if you'd be able to.
Yeah, it's my lunch break, so taking the
Okay.
opportunity to hop on for a few minutes. But yeah, I'm here, of course, in regard to. So me and my wife were basically the founders of a group called One Body, Many Members, that really has desires to unite and join the body of Christ, and so that we work efficiently according to God's purpose, and allow God's kingdom to come here in this place. So we recently launched one-body.org. So that's why I'm here, and just wanting to help Rochester in any way we can.
Well, we're so excited to have you here. Yes, one-body.org. It's a great place for people of Christian faith to be able to come together and communicate with each other. And so it's an excellent, I love the website, and I think that Kamal and his wife are doing a great job with it. So I'm really excited about that, and I'm excited to have you here. Any other newcomers real quick before we move on?
Hi, Leah. Hi,
Lisa.
Hi.
How are you?
Oh, I'm hanging in there. I know it's been a while since I've attended. I've just trying to get back connected with different community organizations. So
yeah,
I'm Lisa Goff. I'm a retired nurse. I volunteer with a number of organizations, Common Ground Health, working with the churches with the Interdenominational Health Ministry Coalition there, as well as the African American Health Coalition. I also recently joined the Lions Club, the Rochester Host Downtown Lions Club, the NAACP, and the Black Nurses Association. So I've been just kind of busy doing virtual meetings, and my goal is to connect and share resources, collaborations, partnerships, all of those good things is what I'm doing. I've also been trying to work hard on the COVID issues around helping people sign up for their appointments, as well as doing the COVID testing. I've been involved with that with some of the African-American physicians and nurses in the community as well. So I'm glad to be here.
Awesome. Yay, Lisa. Well, thank you so much. We're so glad to have you. I
Thank
see
you.
a couple of other unfamiliar names and unfamiliar faces, but if you don't feel comfortable coming on and introduce yourself, we're not gonna twist your arm. So if you'd like to come on and introduce yourself, please just raise your hand or wave at me, and I'll I'll let you in. So Cynthia, come on and introduce yourself.
Hi, I'm Cynthia Pasha. I'm part of the systems integration team. I just started as the communications lead there about a month ago. But I've been in the nonprofit sector here in Rochester for over 20 years. So really invested in what's going on in our community. I volunteer with a lot of different organizations. So really interested to hear what everyone has to say today.
That's awesome. Thank you so much. We're excited to have you. I love the systems integration project, and I'm so excited about all that you guys are doing. And Tanya Potter, I think you popped on there. How are you?
I'm good, thank you. It's not actually my first meeting. I was actually at the very, very first meeting, but haven't been able to make it back since. I have a business here locally called Virtual Ops, where I provide support to business owners, either through controller services, CFO services, bookkeeping, things of that nature, all done virtually since 2016. So we work with a lot of local entrepreneurs and small businesses, and really kind of look to help fill the gap of what they have going on in their daily operations. And just looking forward to seeing what you guys are doing and seeing where I can, hopefully support.
Awesome. Thank you so much, Tanya.
Hi,
All right.
hi, Leah.
Nikisha, hi.
Hi, I'm Nikisha Ridgway. I'm the Chief Operating Officer at Starbridge Services, and we support individuals with disabilities. And there is a huge intersection between disability and poverty.
Yeah.
And I just wanted to join in and learn more. Thank you.
Awesome. Well, we're excited to have you here. Thank you for being here. It looks like people are getting like booted out and then they're coming back in. But I think we've got everybody now. All right. Anybody else want to introduce themselves before we go on? All right. So, how many of you have heard of the app Clubhouse? Raise your hand, wave at me, blink your mic, whatever you want to do. Blinking your mic is a fun thing to do in Clubhouse. So, so Clubhouse, I'm fairly new to Clubhouse. I actually just started a couple of weeks ago, but I've been a part of some amazing discussions surrounding poverty, surrounding mental health, surrounding business in general, business development, and things like that. So it looks like quite a few of you are familiar. I'm hoping some of you are a part of it. Today, as just kind of like a fun thing, let me just make sure that I've lowered everybody's hands. I hope everybody knows how to raise your hands. We have Annette here on here. She's going to be helping me out with this fun giveaway. I have one invite for Clubhouse to give away to somebody. And for any of you that know Clubhouse, you know that Clubhouse gives you like these sporadic invites. They're like, oh, okay, you've used our app enough. We're going to give you some more invites. And I've found that people are like looking for these invites. I've had a couple of people that are like, oh my gosh, I need an invite. Next time you get an invite, let me know. So I actually started keeping a list of people who needed invites and gave them invites. For those of you who don't know what Clubhouse is, it's kind of like Zoom meets Facebook. It's like all these different rooms with different topics that you can be a part of, but there's no video. It's literally just your face and your profile. And there's all these different rooms that you can be a part of that you can talk to people. Different people moderate different rooms. So it would be kind of like this room here where, I'm the moderator and Angie was, helping moderate the room. And there are like different moderators in the room, and then you can actually raise your hand and ask questions to like a lot of really influential people in different spaces. I've been a part of the Millionaires Breakfast Club, which I think is super fun because there's all these millionaires there chatting about like how they went from zero to their first million and like different things like that. And it's just kind of a fun thing to do. So that being said, if you have an iPhone, because it's currently iPhone only, so if you have an iPhone and you're interested in an invite, if you raise your hand or wave at Annette, she's going to write your name down and put you into a drawing today to receive a Clubhouse invite. So Annette, are you there? I just want to make sure Annette's capturing everybody that.
Yeah, I'm here. I'm getting it.
Can you see the people that are raising their hands?
Yeah, give me a minute.
Okay.
Okay, so
I
far.
saw
hold
somebody
on.
do the clapping thing and
Yeah, I have
so
one.
you got that person because that one goes away fast, but the raising the hands
I
stay
got
put.
I got 3 names. Yeah.
Okay.
Mhm.
All right. So there's only 3 people that want to be a part of Clubhouse, right? Or that aren't already a part of it. That's okay. That's good. All
Did you
right.
get my
I don't know
name,
how to
Leah?
raise my hand today for some reason.
You don't know how to raise your hand?
I
It's okay.
normally can, but for some reason today I'm not seeing it. Oh, well.
Okay, but Dale, you're interested?
Sure.
All right, so Dale,
Yeah, I put it down.
is there anybody else?
Leah, did you get my name? This is Jeanette.
Yes, I
think-
have Jeanette, Lisa, Dale, and Kelly.
Thank you.
Can you add Alicia, please? I can't raise my
Okay.
hand.
Okay.
Thank you.
You're welcome.
Okay. Anybody else that can't raise their hand or clap or do any of those things that's interested? All right, so we're gonna do that drawing after our 2, well, we have three speakers today because we also have Kevin who's here, or Ken who's here from, I can't even read my writing. Is it Ken who's here from HEAP, who's gonna share? Ken Bird is gonna share from HEAP. And that was a last minute add to the agenda. So, so we're gonna start out with systems integration. We're gonna start out with Angie with systems integration. I wanted to say that I'm very excited about the systems integration project. There's social service work group, the RMAPI group. I think that when you look at the Smarter Cities report, and it can be extremely daunting, right? Because it's so big and there's so much information in there about what needs to be done in our community to combat poverty. And so for those of you who've had a chance to actually read it over, and for those of you who have read it in full, I commend you. It's a lot of information. And I think that the benefit of having Angie and Lorianne, and I wasn't able to capture anybody to come today for SSPWG, so I'll share a little bit on the charter for that because Carol gave me permission to do that. But I think that there's a lot of work that's already being done, and I think that it's important here as a collaborative for us to be able to hear some of this work that's already being done so that we don't reinvent the wheel of what's already being done, and we can figure out how as a collaborative we fit into the picture of being able to support these initiatives that are already happening. So Angie, we're so happy to have you here today. Go ahead and take it away and share with us some things that are going on over at systems integration. Did I make it so that you could share your screen?
If you, oh, yep, you did. Thank you so
Okay.
much. Okay, thank you so much. I appreciate the opportunity to share a little bit about systems integration. Please stop me if you want to ask questions. I think Leah,
I'd be appreciative of it because we can't both sit here, I don't think.
Leah's giving us about 10 minutes each to talk, so I'm going to go ahead and get started.
Yeah, and then we do have a Q&A section too.
Okay, perfect.
So if
So
you
we can
want to
hold-
just continue, and then I'm just trying to mute everybody's mic. So if you're not speaking, if you could just mute your mic, that would be helpful for background noise. But yeah, if you want to just go ahead, Angie, and share all the way through, and then there's a Q&A section at the end. So if you have any questions for Angie, write them down. It's challenging for me to monitor the chat at the same time, but if you have questions, you can also put them in the chat and I'll do my best to monitor it.
Thanks, Leah. Okay, so I was really excited for the chance to talk today about systems integration because in a lot of ways, the systems integration project got started several years ago as a response to the IBM Smarter Cities report. And so some of you who are familiar with systems integration, the slide that you see is kind of a signature slide that is often shown to show the very complicated system. You know, this picture represents federal sectors and their spend for individuals who are low income. It's a good visual of the silos that exist on a local level. And really the thing that should be obvious is it's really impossible for an individual to effectively navigate this, and we need a more rationalized approach. And so the headlines from the Smarter Cities Challenge report that systems integration has really focused on being a response to have been the issues around having misaligned services and programs, having reactive transactional service delivery. And I want to pause on that one a little bit. You know, I think what I've seen and what I've heard from talking with you know, members of the community is that we do a good job of getting somebody a box of food or you know, help with a specific need, but helping individuals to sustain food security and to be able to continue ongoing, that's an area where we struggle. So really kind of addressing that reactive transactional service delivery and thinking about how can we invest in solutions that drive more sustainable results. The lack of person-centric delivery and measurement systems, one of the things systems integration is really working toward is a person-centered system of service delivery, directly in response to this challenge that was raised out of the study. And then finally, an inconsistent approach to data. And I think, you know, that's, I think, very typical that, you know, across the sectors, you know, healthcare, there's a huge investment in data and data systems and how data is captured, much less so when it comes to human services. And especially, you know, in the not-for-profit space where there aren't as many resources. So the way that data is collected is, you know, it is not consistent across the sectors, nor should it be. But how do we try to bridge the gap? One of the things that we know from doing business requirements interviews is that if you look across the sectors of health, human services, and education, the information that individuals want to see in order to have a holistic view of a person, it overlaps quite a bit. And so where education might be looking for information, it's information that human services or healthcare might already have, and vice versa. So there is a way to take these different approaches to data collection and bridge the gap in order to have a more holistic view of the individual that's being served. So the collective vision of the systems integration project, I won't read through it here, but I do just want to highlight a couple of things. Systems integration began in the summer of 2017, and one of the very first things that happened as the project got started was to establish this collective vision. You know, part of that collective vision is, you know, working across a diverse network of providers and building an interconnected, as I said, person-centered system. And part of that involves establishing an information platform. And really the end goal of why we're doing all of this is to help improve well-being with a focus on those who are vulnerable or impacted by poverty. So we would really, our main focus is changing that messy web and tangle of a system into something that's navigable and results in better outcomes. The group that got together in 2017 consisted largely of the organizations that you see represented on this slide. It's grown over time. This is the group known as the Systems Integration Team. The Systems Integration Team acts as a steering committee, if you will, for the Systems Integration Project. They drive strategic decision making, and they you know, are champions of the systems integration work. You know, these are the organizations that systems integration will be looking to be early adopters of the integrated service delivery model and the data ecosystem that systems integration is looking to build. The way that the project is organized, you know, we really focus on three main strategies in order to achieve our vision, and that is data sharing, flows, and human-centered design, which you see in the middle. Data sharing obviously is going to require us to have agreements in place so that we can share information with one another and across sectors. From talking with individuals who are users of the system, there's an assumption that their information is largely being shared anyway. And so it's surprising, the extent to which that integration doesn't happen. It's surprising the extent to which I have to go from place to place, filling out intake form after intake form with the same information. So I think about that data sharing not as just the information platform or the technology system, but also the legal framework that's going to enable organizations to share information with one another to serve individuals. The workflow side of thing is really about service delivery redesign. So how do we pivot from that transactional reactive mode to a more proactive and collaborative mode of delivering services, really focusing on not just what I need to do to meet funders' requirements, but what I need to do to meet the requirements of the individual standing in front of me. So how do I make that more person-centered? How do I focus on things like being, trauma responsive and culturally competent, and above all, not asking people to have to tell their story over and over and over again, but instead helping them navigate, the system and their needs in a way where it's respectful of the fact that, I'm going through some things and I need, to be able to get to these resources, and don't you already have my information? So the data sharing and workflows piece really go hand in hand. And then finally, human-centered design. This is, it's listed under our strategies, but it's really an approach to how systems integration goes about doing its work. That involving users, a variety of users, and really going out and actively engaging community members with very lived experiences in order to design solutions that essentially lift all boats. I think a great example of why human-centered design makes sense in our project, in an early training session where we were learning about human-centered design and the value it brings to our project, we learned about the curved sidewalks. So, curved sidewalks, when they were originally installed, it was intended to be a solution to help with individuals who have difficulty with mobility. So it was really designed to be a solution for individuals who have mobility challenges. And lo and behold, curved sidewalks ended up becoming a solution that really benefited everybody. Think about how, in addition to people with mobility challenges, we're now helping mothers with strollers. We're now helping create, recreational opportunities for people that want to bike or skateboard. And so the curved sidewalk example, I think, is a great one that shows how human-centered design and approaching different types of user experiences, you can come up with a solution that really creates wins for everybody and a better solution for all. So in terms of what will be different when systems integration has delivered, taking some of those challenges from the IBM Smarter Cities report and sort of painting a future, what we wanted to kind of do for everyone is kind of break down how we'll tackle misaligned services and programs. And our approach for that is to create a technology platform that establishes a 360-degree view of a person. Our goal is to have 150,000 individuals connected via this technology platform, and have a view so that things that are benefits and assets in an individual's life can be seen contrasted with areas that may be risks or concerns, and all members of that person's care team can see that information and understand where the person is coming from and what things they may be able to assist with and what things they may be able to refer assistance for. So that's a really important part of our scope. And so our plan and what we're working on now is building out a digital solution using shared language, which describes across different domains service pathways that really help an individual who, you know, based on any given point in time, might be doing, you know, well in some areas, might need assistance in other areas. And so looking to create that 360 dashboard is kind of a big part of our scope. We'll also have the ability to measure and calculate return on investment. You know, it's really important as you think about how much funding comes into our local area, and making sure that we can measure how we're doing against the investment that's coming in, and are we getting the outcomes that we expected. So that's a really unique part of the project. With respect to disconnected and reactive service delivery, that is where our focus on integrated workflows and getting organizations to collaborate and work together, especially in a way that is across sectors. So creating the processes and the pathways, communication pathways, so that if I'm a teacher, I have the ability to, you know, as needed, communicate with members of my students' care team, whether that is, you know, a social worker, or whether that is a pediatrician or primary care physician. So we really are focusing on the integrated service delivery model to address the need for that cross-sector collaboration. And the work that's underway in this space have really been focused on pilots, system redesign pilots. We've worked on pilots in eviction prevention. There is work underway on a youth behavioral health pilot, and as well some planning underway around employment pathway pilot. Systems integration is participating in some of the COVID vaccination work, and then right now designing what our future integrated service delivery model could look like, so that there's an emphasis on, I think this was talked about in the last meeting, an emphasis on not everybody duplicating services, but rather perhaps within, you know, a neighborhood, there is coverage of all the different types of services that someone might need. And I know Leah mentions the body analogy. So I think that conversation in last month's meeting was really, I think, along the same lines of what systems integration is thinking about with integrated service delivery model, and how do we make sure that for a given area we're covering all the needs and we don't, you know, duplicate or gap the needs. Finally, little input from those who really confront head on the fact that all too often in the past, those who are impacted by the system have been left out, and it hasn't been really a co-creation of what the system can and should be. And so in our future system, we would have organizations and community members that are trained to collect and leverage and amplify community input to redesign the system. And that's where our human-centered design approach comes in. Right now, what's underway, we are contracted with a global organization called Design Management Institute. They're a nonprofit that focuses on design and innovation. And we're working this year to roll out some added training, which is an opportunity if someone is interested. We're going to have open general awareness training for human-centered design. So I had that on the last slide as an opportunity to connect with us through that training if that's of interest. Just in case you're less familiar with human-centered design, so just want to answer the question, you know, why and what is this all about? So for us, you know, what's so important about human-centered design is that it starts with people, and it starts with looking at solutions that are desirable, and then layering in what's going to be feasible from a technology and can we do it perspective, and then also layering in what's viable from a business and sustainability perspective. And the idea of human-centered design is that you're finding the sweet spot between those three elements, so that, you know, you're ultimately landing on solutions that people want and solutions that can be sustained. I said a little bit about community engagement already, but it's critically important for systems integration to involve community voice. And Juanita Lyde, who is on the call today, is our senior community engagement lead for the project. And she's, probably talked with many of you, but as far as the work that all of us on the project staff are focusing on under Juanita's leadership, it's really about making sure we've got our community voices network, which is our community advisory group, at the table and providing input regularly, having that supportive and bidirectional communication between community members and project office, not asking for input and then, never seeing anything from it, right? Like making sure that we have those feedback loops. Diversity inclusion practices are hugely important. I've spoken already about human-centered design. And then finally, the Equity Review Board is a group of volunteers that come together on a monthly basis. And we have a commitment to review around 80% of our project deliverables will go through the Equity Review Board. And the goal is to ensure that through different lenses, different lived experiences, we aren't missing something. So, having a Equity Review Board comprised of a very diverse group of stakeholders who can weigh in and lean in on, have you considered, the effects of the deaf community on, based on your solution? Have you considered the effects of persons with disabilities? Have you, it's really a wonderful opportunity that we have to be able to make sure our solutions go through that board, and we have an opportunity to, not only focus on building equity in, but also hearing input and feedback on where we can improve. The technology solution that systems integration is working on building out is just getting started. And so over the next 15 weeks, we're going to have demonstratable working software that we'll be able to share out and demonstrate how it's coming along. What you see is really just a mock-up of what it could look like. We're looking at, how do we put together a digital front door that allows someone to find what they need and drill down into neighborhood-specific information. So this is just a concept of what our digital front door could look like, and more to come, as I said, over the next 15 weeks as we're building this out. Behind that digital front door, we are looking at creating the individual record that is their 360-degree view of themselves. It would show, information that they've supplied about their, contact information, demographic information, members of their care team that they have selected, and how they feel that they're doing across the different domains, whether it's housing, food security, transportation, et cetera. And then similarly, providers who are part of that care team would have the ability to see how their client or patient or student is doing, and see more about that person than what they typically see. And so this work, as I said, is part of the work that we're doing on our technology platform over the next 15 weeks. In addition, this year we're focused on the workflows, and the workflows we're starting to think of through the lens of user journeys and how a user might navigate that web of a system today, and how we make that web of a system simplified tomorrow. And when we break it down, the different workflows that are involved, whether it's navigation, point of entry, which is where do I begin, intake, which is the process that I go through to begin, the information I have to give and the story I have to tell, informed consent, sharing my information, agreeing to share my information, knowing what all that entails, service pathways, which is the different custom interventions that might be appropriate for me given where I'm at. An example of what I mean by service pathways could be if we're talking about eviction prevention or housing as an impact area. It could be where I am at is that I'm sensing that I'm going to fall behind on the rent payment next month because my hours have been cut. I'm at a different place along a service pathway than somebody who has received a 90-day pay or quit notice and is, 3 months behind paying rent with, no job prospects. So there's different places that a person may be. And so with respect to that, the service pathways identify kind of where people are and what might be appropriate steps to take. And then finally, referral management. I think this is something most people are very familiar with. Making referrals for services that live outside of your own four walls. We're involved with the 360 Collaborative Network. That's the group of providers that are using Unite Us. And we're also just looking at referral management more generally, how it's being done in different places, whether it's part of the 360 Collaborative Network or something different. So that's another really important workflow, because we know in order to help improve outcomes, we need to be able to help people get connected to services easily. And to have that closed loop to see that it happened is really critical. The impact areas that we're focusing on are listed along the right. These are just a few of the domains that systems integration intends to tackle. Our list of domains that we focused on was originally 18, of which childcare was one of them. And I mention that because that's one that frequently gets asked about. And we were asked to focus in on these vital few for the moment, because these felt like the impact areas that, given where we are with COVID and the recovery, that these would be the areas that would be of most import as we work on, reimagining and recovering from COVID. And then just one sort of case study. I spoke a minute ago about eviction prevention, and this eviction prevention pilot initiative was one that systems integration was involved with, along with Monroe County, who was the sponsor, and the organizations that you see listed on the slide in their icons or their logos. This was work that systems integration did to help advance our thinking and our work around system redesign. It was really intended to be a coordinated response to the COVID-19 crisis and help folks stay stably housed. So systems integration's part in this was putting together the integrated workflow and putting together the communication mechanisms and systems, putting all that together so that this could happen. And Monroe County was the sponsor of the pilot. But it's really exciting because it was the first meaningful pilot where we were able to help a significant number of households. Just over 1,800 households got assistance. It's really incredible, far exceeded our estimates. Over 40% of the folks that requested assistance were able to get it. So it was an important, testing point of looking at system redesign and how systems integration is approaching things. And I want to say this was where using our human-centered design skills really helped, and going out and testing a prototype with users, whether it was individuals who've used emergency rent assistance services in the past or case managers who work at some of these organizations. We were able to get input and hone our workflow based on that. In addition, some of the big ahas that came from the eviction prevention work were just getting some of the barriers removed along the way. And I think this speaks to, really trying to take a systems approach, not just trying to address the transactions, but trying to systematically address some of the things that get in the way of getting help. And so these barriers that we were focused on removing with the eviction prevention pilot initiative, not requiring people to have to go to public assistance first before they could be helped by a community-based organization, not requiring that people have to be in a 12-month lease and pushing on that, pushing on, the court-ordered eviction petition. That was something that the county's eviction prevention pilot initiative removed as a barrier. And then having intake appointment flexibility and virtual options, obviously important during the pandemic. And then something we piloted and learned a lot from was the notion of having neighborhood-based front doors. So having organizations that maybe they weren't administering the funding, but they were a conduit to helping a person apply and helping a person get rent assistance through one of the community-based organizations that was distributing funds. So this is my second to last slide, just a little bit about our project and who we are. I think I surprised Leah in a meeting, and we've been talking for almost a year now, but she didn't realize that so much was going on. So just want to share that since fall of 2017, systems integration has, aligned on a shared vision. We have a culture that we operate with, and our systems integration team is all working together per their signed operating agreement. We have 100 participating organizations. Our systems integration team has 40 organizations that are a part of it right now that represent the sectors that you see here. Our staff, there's 12 full-time employees, and we staff work groups of subject matter experts. We have 12 work groups total. We do have a 5-year project plan that puts us to March of 2024, and we operate using an agile sprints cadence. So every month is our sprint cycle. We've received $16.3 million in funding to date, and we have over or approximately 350 actively participating individuals across all the work groups and pilots and things like that. So that's a little bit about us. And then I'd love to open this to you. So how can you get involved? So we're really committed, as I've said before, to ensuring that the voice of the community is infused throughout this project. We want to make sure that those who are impacted by our project work are involved at all levels. So we are recruiting folks who use programs and services, community advocates, and cultural brokers. We'd love to have you participate on our work groups and in any other areas of the project that may be of interest. As I mentioned, coming soon, we will have general human-centered design training. And the goal of that training is to increase our community's knowledge and practice of working with users to co-create solutions. Really trying to seed that practice throughout community so that we don't continue to repeat the pattern of solving problems by going and creating programs without talking to people, right? So we want to try to, bring our work to community and co-create. So if you are interested or know someone who might be interested, please reach out to me. I'll be happy to tell you more about the different work groups or get you, on our sign-up list for the training. And with that, I'll go ahead and turn it back over to Leah.
Awesome, Angie. Thank you so much. Oh my goodness, so much information. But it's exciting to hear all the work that you guys are doing already at answering some of the recommendations of the Smarter Cities report. And that's what this these last two collaboratives have been about, is talking about that report and what's being done. So I definitely appreciate that. I want to move on to Lori Ann, because I know that a lot of people start to jump off at around 1, but I want Lori Ann to be able to share. We do slate this meeting till 1:30, but I know everybody has different schedules. So if you can stay on till 1:30, it'd be great. But Lori Ann, go ahead and take it away and share with us about our MAPI.
Sure thing. Happy Monday, everyone. My name is Lori Ann Garambe, and I oversee the community engagement efforts for our MAPI. And so I'm going to try my best to make this as quick as possible, but let me go ahead and not stop my video, but share my screen.
There you go.
Okay. All right, so for any of you who are not familiar with our MAPI or the Rochester Monroe Anti-Poverty Initiative, so we are a collection of individuals and organizations working together in new ways to tackle systemic root causes that contribute to poverty. More specifically, we're table stakeholders working together to reduce the poverty rate in Rochester. So our MAPI is made up of community members, human service organizations, funders, businesses, government officials, religious leaders, and many more. And our MAPI follows a collective impact model structure, which basically says poverty is too big of an issue, too big of a problem that not one person or one organization can actually solve it. And we need all those who touch the system to really work on figuring out what tackling poverty looks like. Our MAPI specifically focus on increasing self-sufficiency through sustainable employment and living wages. Again, one of the key ways to help people get out of poverty is by ensuring that they're able to work, but not only work, but ensuring that they're making livable wages. A lot of the data shows that in Rochester, over 60% of people living in poverty are actually working. And not only are they working, a majority of them are working 1 to 2 jobs. So what does that tell us? It tells us it's not that people don't want to work or that they can't work. It's that they're not really earning a livable wage. And then we're also focused on ensuring greater access to affordable basic needs like housing, transportation, childcare, and food. You can get somebody their dream jobs, but if their basic needs are not met, they're not going to be able to sustain and maintain that job. That's why those are the 2 areas that we focus in specifically in our MAPI, understanding that this is a community effort and that there's so much great things that are happening across the community, and this is where we focus our efforts specifically. So I tried to put the IBM report back in my head so that I can work through some of the updates that we have to kind of help us flow as we move forward. So really, as you can see, one of the recommendations, several of the recommendations that were made throughout the IBM report really spoke to this idea of coordinated services and better coordinating services, right? We need to be better aligned and we need to establish a more person-centered service delivery. And so one of the key ways that our MAPI really came out the gate swinging with that was really with the establishment of the Social Service Revision Working Group, which I believe you all have gotten some presentations about as well too, that originally was under our MAPI and now it's being supported fully through the United Way. And again, that group is really focused on better understanding the system of service provision, understanding what works, what doesn't work, and what solutions actually might look like so that we can be better coordinated. Echoing a lot of the things that Angie shared earlier before. And then speaking of Angie, systems integration was one of those things that came out of early our MAPI efforts, early our MAPI findings and learnings. And our MAPI played a key role in really advocating for and ensuring that systems was a project that we had here in our community to do the work that Angie just laid out that is being worked on. And then another key part that I put in here, again, this is speaking from my community engagement lens, is to do this effort to really touch on these recommendations. It's really important that we shift the narrative and humanize the lived experience of those with the lived experience of those impacted by poverty. Ignore my incomplete sentence there. But again, too often, again, like Angie shared, too often we're trying to create solutions for people who are not invited into that process at all. And then we step back and wonder, well, why didn't this work? You never asked, you never really got to know what people were going through, what works for them, what doesn't work for them, et cetera. And so it's really important that we invite them into this process as we are trying to coordinate services and better align our services. Because as you'll see as I talk a little bit more, as service providers, as people who work in the system, we definitely have our lens, we have our view of how things are happening, but from those who are receiving these services, a lot of times it's a different experience, and it's important that we bring both of those experiences to the tables as we're looking to create solutions. Next, again, this idea of being proactive and not preventative. The past year or two, our MAPI has been working on really establishing what we call our MAPI employer pledge. And the idea behind this is really lifting up best practices for employers in terms of hiring, retention, promotion, trying to be more person-centered as employers and supporting folks, understanding all the different barriers and issues that people deal with on a regular basis. And to date, we've had over 50 employers who've signed on to that employer pledge, including the University of Rochester, who most recently just made a commitment to establishing $15 minimum wage across the board for their employers, for their employees. And I have a link for that, and I can share that with you all as we move forward. Again, this is just an example of how we're trying to be more proactive and preventative, because again, we know that employment is a key thing if you're trying to get people out of poverty, and we can't just settle with just getting somebody hired. I used to be a case manager, focused on getting people work, and I could get somebody hired like that, but the issue was having that person be able to stay in that job was a lot harder when we had to navigate through the different barriers that they were dealing with. And so this employer pledge really speaks to that across the board, and the $15 minimum wage was one of the things that was highlighted in there as well too. And U of R is kind of taking the lead on that and kind of leading the way. So that's been really exciting news for us as we move forward. And then next, again, there's a number of recommendations that I think really fall under this idea of elevating community voice and choice. And this is where I get really excited because it's speaking my language. Many of you may be familiar with our MAPI's guiding principles of addressing structural racism, addressing trauma, and community building. And these guiding principles are really, really important and key to the work of our MAPI, because this is our way of making sure that we're working at a systemic level rather than just trying to band-aid problems, right? This forces us to look at the root causes of the problems that we find ourselves in, right? So you can't talk about poverty and not talk about structural racism, and not talk about trauma, and not talk about the fact that our communities have been really broken down in ways that have been really detrimental. Now we're trying to figure out what does it look like to rebuild community within a lot of our communities here in Rochester. So the guiding principles are one of those things, are a key part of the work of our MAPI. We've done plenty, and we continue to do different presentations around helping people better understand what structural racism is, using data to really make it clear that you cannot talk about poverty, not talk about structural racism. And until those things are understood, we're going to continue to band-aid the problems rather than deal with the root causes. And then again, community engagement, authentic community engagement specifically, is a key component of the work of our MAPI. It is non-negotiable, and really it's lifting up the importance of voice and choice and telling the full story of those who are impacted by poverty. One of the examples of how we do this is last year, at the start of the pandemic, we started collecting feedback from community members to better understand what their current needs were and use that information to inform what solutions were being brought forth. And then from that, we developed a community-wide survey that was up through the months of April and May. And we engaged with over 500 community voices of people impacted by poverty. And through that, we produced what we called our MAPI Community Concerns Assessment. And again, I will share this link with you as well too. And it really helped us get an insight on what people were really caring about, what people really needed now that we were living in this pandemic, and what this new normal looked like for folks. And it really helped us be able to use that to help focus what we're doing as we move forward. And that report has been shared widely throughout the community, and we've seen plenty of examples of different organizations using the findings in that report to really kind of inform, but actually inform the work that they were doing and how they were adjusting as they move forward. Again, lifting up community voice and having that be a key part of how we co-create solutions as we move forward. Our MAPI has established an experts by experience cohort model. Again, in the work of our MAPI, we view lived experience as expertise. The same way I may have my degrees that make me an expert to be able to do this job, my lived experience as somebody who experienced poverty also gives me expertise to be able to do this work. And so too often we are missing out on key resources, and that's something that was shared throughout the IBM report as well too. There's so much untapped potential within our community to solve the problems that we're trying to solve. And so this experts by experience cohort model really allows us to invite community members with lived experience into the work with our MAPI, support and building their capacity, and support them to be able to show up fully at these tables so that they're not tokenized and it's not a checkbox. But that process also has us preparing the tables as well too, so that when folks come to that table, they're actually hearing each other, and those walls are kind of being torn down as we move forward. So currently we have a cohort of single moms that we work with. Single moms is a population group that we focus in our MAPI, and the reason for that being, we all know that our Rochester has high numbers of childhood poverty. And what the data shows us is over 80% of those kids who are living in poverty reside in single female-headed households. Now, kids can't work their way out of poverty, so we have to make sure that the strategies and solutions that we put forth are supporting those single moms to be able to actually make a livable wage and that their basic needs are being met. And so we have a cohort of single moms to help elevate and infuse the voice of single moms into the work of our MAPI. So they participate in our various working groups. They participate through the different projects that we have. They convene their own community listening sessions, community conversations with other moms to bring up different topics that are going on in our MAPI to really make sure that we're tapped into those voices. And most recently, we just established a frontline workers cohort. Again, this name was established prior to the pandemic. And so when we say frontline workers, we're really speaking to those individuals who are working, but still struggling, right? So think about your entry-level case workers, case managers. Think about your cashiers, your environmental services workers. Think about your CNAs, your home health aides, right? So people who are working, but they're still struggling. And a lot of them are working more than one job. And so we have a cohort to lift up that lived experience in the work of our MAPI to make sure that we are understanding what those needs actually are and what viable solutions might look like. We also have in our MAPI Community Advisory Council that we've been working with since the beginning of our MAPI. Again, these are community members with lived experience who are really helping inform and guide the work of our MAPI. We do various community listening sessions and conversations on different topics, whether it's we have a draft policy agenda that we're trying to finalize. We want to make sure that we have community voice and input in that. Whatever the topic may be, we always have these community listening sessions and conversations to be able to lift up the voices of those impacted by poverty. Recently, we partnered with DHS last year for them to do their first listening session. We supported them through that process to really hear from people who receive services what their experience has been like and is like as they're navigating the DHS system. And so that was really eye-opening. And those are the types of lift up the importance, as Angie was sharing earlier, of listening and co-creating what solutions look like. We've done several journey mapping projects to better understand how people experience the different systems that we have in our community, be it housing, be it employment, et cetera. Again, just lifting up community voice. And most recently, we're working on establishing a community engagement network. And this is something that we're doing in partnership with systems integration and Rock the Future as well too. This is stuff that's still very much in the early phases, but again, we know that there's a lot of people out there who do the work that I do in community engagement in different organizations and businesses, and it's important that we have a better network collaboration so that we're not duplicating efforts and we're having greater impact. So there are a lot of moving parts in our MAPI, as you can imagine, and I try to just narrow it down as much as I can, keeping in mind the IBM report. But the IBM report really kind of gave birth to a lot of the work that we do in our MAPI. So we touch all the different parts of the report in one way, shape, or form. And I'd be more than happy to connect with anybody more to talk more about that, or connect you with somebody else on my team who might be able to answer your questions better than me. But I'm going to stop there. Yeah, if you all have any questions or anything, let me know. I'm going to put the links of what I talked about in the chat box so you all could have that. And I'll turn it over to Leah.
Thank you, Lorianne. That was such a lot of information. The one thing that I love is the $15 minimum wage, livable wage that you're doing with the over 50 employers, and specifically with URMC. I think that's an amazing feat. I think that it's so important for everybody to be able to have a livable wage, and unfortunately that's not how it is all across our community. So I'm excited about that work that you're doing, and then also specifically about the community engagement. I think that community engagement is so important to all of our work, right? Because if we don't know what the community needs, then we can't help. So
absolutely. Just quick clarification. So U of R is the first organization to commit to $15 for the whole company.
Okay.
But that is a best practice that's under our MAPI employer pledge. So different organizations have signed on for different best practices, but that's something that's in there. That's not necessarily say that they've all signed on and agreed to do the 15. Yeah, I didn't want to say out here that I'm promising things that I can't really
Oh, no, that's
deliver.
okay. Well, it sounds good. I mean, it sounds like you're moving in the right direction.
Oh, and also we recently just got a new executive, my bad. We recently just got a new executive director, Aqua Porter, who started with us in December. She was our interim director from May to December before she became our permanent. So that's another update that I probably should share.
Okay, awesome. So we're gonna enter into a quick Q&A. We have 10 minutes left. I want Ken to be able to share. Maybe we should have Ken share first. Ken, do you want to share a little bit about HEAP before we enter into the Q&A? Because that way, if people need to hop off after your presentation on what's updates are on HEAP, they are able to hop off if they don't want to stick around for the Q&A, or if they're unable to because of time constraints. Are you there, Ken? You're on mute. I don't know if he's there.
Ken's message is in the chat, Leah. He doesn't have a microphone or camera, so it just says the update for HEAP is that it's currently scheduled to close. HEAP is currently scheduled to close on 3/15. Additional information about the program is available at the link he's provided, and he can email you. Anyone can email him with questions as well.
Okay, I see. Thank you. Thank you so much. All right, so then just Q&As for Angie and Lorianne as far as systems integration and our MAPI. Does anybody have any questions? They covered a lot of information, so it was a lot to take in. I'll start. So I have a question about the technology system, and I'm not sure if we've talked about this before, Angie, and if we have, I apologize for asking the question twice. But I know Unite Us has been working hard on their system. How is the new system going to incorporate Unite Us, or will it be something that will take the place of Unite Us? How do you guys see that working?
So the answer to that is still to be determined. However, part of our work is to develop a plan for closed loop referral management that will be considerate of all the different closed loop referral management systems that are in play. So one of the philosophical things that systems integration has been talking about is, today we have some closed loop referral management system islands where there's these closed networks that are using referral systems with one another. Our goal as systems integration is to connect the islands, right? Create the integration so that the islands can talk to each other. So we are still working on that. And in fact, I am starting this week going to be having some planning conversations with representatives from the healthcare sector and from community-based organizations and 211 to really start to develop what the roadmap could look like around closed loop referral management. I'm being deliberate about closed loop referral management because that's a capability that Unite Us really specializes in and focuses on.
Yeah.
The systems integration data ecosystem, or the technology platform that we're working to deliver, is meant to do more than closed loop referral management. So it's really meant to provide that 360-degree view of a person, enable collaboration and communication between sectors. And so there's some overlap with services and capabilities that Unite Us delivers now. But there's also some gaps. And so we're looking at, as we build out this data ecosystem, how do we leverage some of these existing technological assets that are already in play in our community? And we're looking obviously very closely at the Unite Us piece of that.
Yeah, okay, cool. I was just curious. Thank you.
Good question, yeah.
Any other questions?
Yes, I wondered, because of the volume of information that you gave in the charts, I wondered if it might be advantageous to maybe take us through hypothetical situation. For example, let's take your example of somebody who's on the verge of maybe getting evicted and needs food. Can you walk, either Lorraine or Angie, can you walk us through how that person's going to navigate through these systems? Who do they go to? Are you assuming that they are going to DSS and then DSS is going to connect with you, or are there systems in place where if they go to a church, there are people in the church that can guide them through, or organization in the community? But I just thought if you walked us through a hypothetical situation, it might do more to paint the picture than all the data.
Sure. So thanks for your question, Gary. The idea here is that by having the network of participating organizations all working together with common workflows and a common information platform, if an individual presents, whether they present at the school counselor's office, they present at their primary care physician's office, they present at their church or a community-based organization, that those organizations are connected by the system, the technology system, and common workflows to help that person. So if let's say a really simple example that I think will take a while to get to, but let's say if we agree that our common intake process is to ask someone for their name, birth date, and phone number, right? If that's all the information that I need to be able to talk to any of those organizations that I just mentioned, then the direct service provider that's talking to me can key my information in to the system and see, oh, okay, hi, Miss Brown, I can see it looks like you asked, for some assistance here with rent. I can see, it looks like, based on your income information, we could probably help with some other referrals for basic needs. So I can help get you connected to those. So the idea is that each organization, no matter what sector they are a part of, are taking steps to help an individual, even with those things that live outside of their four walls. And that I shouldn't have to send or be sent to DHS. I shouldn't have to be sent, down the street, but rather I can be connected to any of those things by the person I'm talking to.
Awesome. Thank you. So real quick, I know lots of people are hopping off. Annette, are you there? Do you have the people that signed up for Clubhouse for a referral? Aaron Egloff actually has two Clubhouse invites to give away. So I just, before everybody signed off, I wanted to make sure that you had everybody. So you can draw 3 out of all the people that you have, but did you only have 3 people?
No, I had 5.
Okay, so go ahead and draw 3 of them. I'll write down their names.
All right, you ready?
Yes, I'm ready.
Okay, first one is Dale Segwit.
Dale.
Yay, Dale.
Yay, Dale.
Second one is Jeanette.
Yay, Jeanette. Okay.
Yay, Jeanette. Third is Kelly.
Kelly, what's the last name?
Kelly is what is Kelly's last name?
I'm looking to see if she's still on. Is it Kelly Johnson? Did she ask?
Yes.
Okay.
And that's it? You want one more?
Just the 3. So Kelly, I don't have your phone number. I have Jeanette, I have Dale. But Kelly, if you could email me your phone number. My email address is Leah, Leah, .kaz. I can actually just put it in the chat here so you can copy it and paste it. That might be easier.
Well, Leah, I have 2 invites as well, and I have one scheduled for someone. So I can pick one of these last two names and use one of my invites.
Oh, okay, yeah.
So that fourth person will be Lisa G.
Lisa G.
Mhm.
Is she still on? I'm just looking through the names here.
Yeah, yes, this is
Goff.
Lisa Goff.
The Goff.
Oh, Lisa, yay. Okay, yeah. I don't think I have, Lisa, I don't think I have your direct phone number either, or your iPhone phone number. You have to use your iPhone phone number to get the.
Okay, I'll
So,
send it to you.
yeah, just email me it and I'll get it to Annette. And then Aaron, I will get you Jeanette and Dale's information to text them. So basically the way it works is the person who's inviting you will text you, you'll get an invite, you have to sign up from your iPhone. And yeah, so it's definitely addictive, so don't get addicted to it. Just, you know, monitor it like you monitor everything else, but there's a lot of very good information that you can learn from other people who are further down the road than we are, and also learning from people's lived experiences, which we've talked a lot about today. And I think that one of my big takeaways from today is that all of this wouldn't be possible without all of you and without all of the people that are working so hard to make our city a better place. And so I'm very excited about what there is to come. I know we're out of time, but if there's anybody that has an announcement for any upcoming events or things that are going on in the community that you would like to announce, please raise your hand or wave at me, just so that you can announce that real quick before we take off. I know we ran out of time quickly. I feel like an hour, like we started out with an hour and then we moved it to an hour and a half, but it still seems like it goes so fast. So I hope everybody got some information out of today, and I will be sending out, if it's okay with Angie, send out the presentation that she put together so that you guys have it. And then Lorianne, I don't know how you feel about sending out the RMAPI presentation, but it was a lot of information to digest in a short time, so maybe it would help people to be able to look at it in their free time. So does anybody have any announcements, anything that's coming up that we should know about? I'm looking, I'm a couple pages of people here, just looking through to make sure we don't miss anybody. All right, and I was waiting for, did he hop off? Kevin, are you still here? Okay, so he hopped off. So for next month, I believe what we're going to be talking about, and Kevin Beckford, who is, I believe, I always get the title wrong, but I believe a city council member over at in Pittsford, and he also works for URMC. He's very, very involved in equity issues all over our city. And we're going to be hearing from him next month on redlining in the city of Rochester. And so he's going to be hosting our community collaborative next month, as far as I know. So I sent him a private message during this and he didn't see it. So he didn't text back that that he saw it. So I believe that's what next month's meeting's about. So as far as this, you know, we're certainly nowhere done with talking about recommendations from the Smarter Cities report. I think that we're talking to our MAPI and systems integration and even the social service provisional work group about how does the collaborative fit into all this? So far up to this point, we've been a group of people who come together to network, to get to know each other, to know what each other are doing in the community, and to have different presenters every month. And so, you know, but what does that look like? Do we continue doing what we've been doing and just have people present and have people give us updates and have this be a communication space? Or is there some way that we can support as a collaborative group? So if you have thoughts or ideas on that, please feel free to email me. I did put my email in the chat. But I'm so excited. Thank you all for joining us today. And I'm just going to close this out in prayer real quick. So Lord, I just thank you so much for this day. I thank you for the people that joined us on this call. I thank you for everything that you're doing in our city. I don't believe that anything happens by accident. I don't believe that this group was joined together by accident. I pray that you just give us vision and guidance of how you'd have us to continue. I thank you for everybody on this call and everybody's family. I pray that you keep them safe and healthy in your precious name. Amen. So thank you guys for being here. It was an excellent meeting. Sorry about what happened in the beginning. I will take the emails that were in the chat. If you weren't here in the beginning and you didn't put your email in the chat, throw your email in the chat real quick before we hang up. I'll get out next month's, we'll have a password and everything so that we can't get hacked. So thank you for being patient and thank you for coming back. And I am so blessed by each one of your presents. So have a good rest of your month and we'll see you in April. Bye guys. Bye.